Hi, this is Matt Kendall. I've still got my big aviation earphone. I'm getting some new earphones this week. I'm speaking with Ali today, and Ali did the IEMT practitioner training in October, wasn't it? I think it was October. And so we are now, it's the something of March, it's the 7th of January. This is the first IEMT practitioner interview that I've done of 2022. That does sound like a futuristic year, doesn't it? 2022. Now, Ali's got a very interesting history. She's a consultant nurse. Oh, yes?
Yeah,
No,
that's
consultant
right.
nurse, right? We've just been talking about it, forgotten it already. Consultant nurse within the NHS. And she came to do the IMT training, like I say, a few months ago. She's done her case studies, which are fantastic. We've just been reviewing the case studies. As part of the training, you get this consultation, which we've done, it's been an hour, hasn't it? So basically, I spend an hour with you to go through your case studies, to answer any questions you might have, to give you any help and advice. This afternoon, she will be a certified IMT practitioner. We're going to get that all sorted out for her, which is really, really great. And this interview is basically, we're going to look at her process of learning about IMT and then using IMT, and especially with her background as well, it's going to be really, really interesting, just so we can learn more about it. So, Ali, how are you today?
I'm great, thank you. Yeah.
Excellent. So, before we get into this IMT stuff, could you just please give us a background of your work in mental health therapy, what you're trained in?
Yeah. Um, I have about 34 years experience working as a mental health nurse. For many years, I worked with adults, both inpatient and also out in the community team. And then about 17 years ago, I transferred over to a child and adolescent mental health team. And then specialised in what they call neurodevelopmental disorder, so basically autism, Asperger's, ADHD, and I that's my specialism within the NHS at the moment. But I work within a generic, so all mental illness, if you would, and mental health issues community team for children here on the Isle of Man, and I also trained in hypnotherapy, clinical hypnotherapy, about 13 years ago with Innovisions hypnotherapy. So yeah, that, and I offer that privately
Mm.
outside as well.
Okay, so you've got a very, very strong history, obviously, in mental health. You trained in hypnosis 13 years ago. So let me ask you, how did you hear about IEMT and what made you come and decide to come and train in it yourself?
I had an interest in rapid eye movement therapy for quite some time, wanted to get trained within that. I'd come across it within the NHS and then looked up and realised how effective and how research evidenced it was.
This was
So
EMDR, I take it,
the
yeah.
EMDR, yeah. So I wanted to do training in that, but because I live on this tiny little island in the Isle of Man, it's not always easy to fit training in around everything else, because you've got to basically get off the island, you've got to have the time to actually do that. You've got to have the finances to do that on
Yeah.
top of all of that. So it wasn't always easy to do that. And I'd looked into several options. And then I believe I was actually searching online for an online ability to do that. And IEMT came to my notice. So I sent you an email, and it went from there basically.
Oh, cool.
Um, I think that was about March 2021. I sent the original email
Okay.
and then did it in October.
And did you do your research on me as well on YouTube and stuff
Um,
like that, or
only mildly, to be honest with you.
okay,
It was more around IEMT
okay,
and basically how evidenced that was, and people's reviews on both having it, and also I read a few of the reviews from the training element of how people had found the training, and thought, and also that I'd read a little bit about 5 patterns of chronicity,
mm.
and thought that really makes sense to me to take the evidence of what people had done before and then move it to actually what keeps people stuck within problems, and actually how we can develop a therapy that actually unsticks people, basically.
Brilliant, brilliant. Okay, so consultant nurse, strong history in mental health, discovered sort of EMDR through just like the NHS, thought it was really sort of powerful and very effective, started doing your own research, then came across IEMT. And did you not know about IEMT
No, I'd never heard of IEMT before I actually started to research online a little
Okay,
bit.
okay. Then you did the research, you found myself, and then read some of the reviews and read the research into the 5 patterns.
Mhm.
You then came and did the online training. So the online training is a 2-day online training, as I say in person, but that's a lie. But basically it's all live, should we say. So there was a group, I usually do between sort of 10 and 16 people maximum. So you get plenty of my time and plenty of time to practice. So it's a 2-day course. So basically, what was your experience of the 2-day course? And I'm going to throw a lot of questions at you all at once, and we'll try and break them down in terms of the structure of the weekend, the actual materials presented, the materials that you got beforehand, the aftercare, all that kind of stuff, the way it was delivered, the practice sessions. Basically, what was your overall experience of doing the 2-day training?
Okay, well, I think it's structured really well. I think that anybody who's thinking about doing this training, you need to actually make sure that you actually have those 2 days completely free, so that actually you can give it your complete focus, which I like, because when I do something, I do it right. I don't half-hotch anything that I do. I'm
Yeah.
just not a half-hotch person. So I like the fact that it was full on. It was very structured, very organized, and you sent the information through beforehand. So I'd done a little bit of reading
Yeah.
beforehand. So you're not kind of just thrown in at the deep
Yeah.
end with stuff that you're not actually going to be able to get your head around relatively quickly. I must admit, the first few hours, I was like, I don't know if this is going to actually work for me. I don't know what that was about, or whether I think maybe it was about the fact that it was so different. People need to understand that IEMT is very different from from a load of other therapies that you'll have come across in the past and trained in and utilized yourself. It's very direct. It's contentless, and it's fast. So after I got past those first few hours, and we actually started to do the techniques, and then I was on board completely, and I could see that it was working both with me when we were practicing, but also with other people that I was practicing on.
Yeah.
Have I covered everything there? I'm not quite
Pretty
sure.
much. We'll go into it a bit. So basically, the first few hours. Well, let's start sort of beforehand. So the week beforehand, I send out some videos to watch because I'm trying to replicate clinical settings online. So I send out best practices for working online,
Yes.
basically, all
Yeah.
your technical setup, and make sure there's no sort of cats or people in the background cooking. Just to make it so it's a nice secure environment.
Yeah.
I send out some videos about the patterns of chronicity to go through, and I send out the entire manual. And I also give you some homework because over the weekend you're going to be working on yourself a lot, as in with
Yes.
somebody else. You're going to work
Yes.
on your own stuff. So it's best to prepare and come
Yes.
into this with, well, I've got this issue and this issue and this issue and this memory and that feeling.
That's why I'm saying come prepared to work.
Yes, yeah.
Yes.
Because if I put you into, because I put people into what's called a breakout room. So essentially, we have, say you've got 10 people and me in a Zoom meeting. I make 5 breakout rooms, and I literally put 2, and it's just like this basically. It's just 2 people in a room, which I then monitor and I can go into should there be any need for me to be. And that's where you do your private practice exercises, where you go back and forth as being both the practitioner and the client, and it's then reversed. Um, I want to make sure that the weekend that we have is as productive as possible. So by giving
Really.
you the manual and the videos, you can come into this, and I'm not just literally reading a manual to you, which I've been on some courses, and that's what it's basically been. And I thought I could have just done this at home. So the more stuff you can do in advance, and the more you prepare, it means both I don't need to do as much theory on the course, we can do more exercises, and the exercises that you do, you're not just there thinking, well, what should I work on? Rather than, right, I've got this to actually work on kind of straight away.
Yeah.
So the way that I structure everything, it's all broken down into about 13, 14 modules. I do an introduction, a demonstration of some kind. You then go and do it yourselves in a private room. We then have a review, any feedback, any questions, and then we move on to the next thing, and we build it up basically like a Lego set, you know, sort of, maybe. And so we build it up bit by bit. So for the first couple of hours, it is the most theory that we do all weekend. It's me going through the patterns of chronicity, the history of IEMT, and why we believe it works, our understanding of kind of why it works. And then we start getting into the actual techniques themselves.
Yeah.
So when we started doing the techniques, because you had no experience in doing the techniques, so as a consultant nurse with somebody with a strong history of mental health, what was that like? First of all, seeing me doing it with people, and then you actually experiencing it yourself.
When you see it with somebody else, your doubt is that the element of doubt. It's like, really, that's worked that quickly and effectively. This is what I mean by it's so different and it works so quickly. And your for want of a better way of putting it, your bullshit kind of alarm going off.
Yeah.
And you think, really, is it really doing that? It's only when you actually start to work on it yourself, or you have somebody practice on you on your issues, which I'd done all of that and prepared quite well for the weekend, and you've experienced yourself how this stuff actually just isn't there anymore. It has no significance anymore or importance within how you feel on a day-to-day basis. It's memories that have been stuck for so long in your head have just kind of, they're still there. You can access them if you want, but they've not any negative connotation anymore. And it's only when you experience that yourself and you see it with other people that you actually begin to think, this is fantastic. This is wonderful therapy that is so easy to get your head around. And there's so many tools to actually bring in for different elements of people's issues, really. Go on.
What I like about IEMT and the community, we're not allowed to be sensationalist.
No.
We're not allowed to make any promises, say it cures anything. Basically, it's an exploration of a problem, an exploration of the memories and stuff. With a lot of the NLP type, now I love a lot of NLP, but I don't like the whoa, and I don't know what that was, but walking on hot coals and breaking arrows, and I don't think that really helps with things.
And I think I'm a bit the same, Matt.
Yeah.
I've never trained in NLP, partly for that reason, but I've also, down the years, people have said, you remember the tapping stuff, emotional freedom and stuff. And I've gone to stuff and given it a go, but I've never actually experienced or seen fantastic results.
I've seen a lot of stuff like that where it's quite evangelical, and and if you look at sort of like even sort of Southern Baptist kind of, it's like a mass hypnosis, when they're touching people, their faith. I believe it's with IEMT, it's here are the tools, go use it, report back. And I even I've done seminars and lectures between about 60 and up to 200 or so people, and I'll get them doing just the simple patterns with each other. Because what I like about it is very, very simple to learn.
Yes.
A lifetime to master, but it's very, very kind of simple to learn. So the first day, it's all about memories and emotions. And did you find it interesting so we have like a simple and a complex pattern, basically. The simple pattern we generally use for standout memories, stuck memories. And then the integrated pattern is going to the imprints of things. How did you what was the experience like going to like imprints and working with people going to imprints of why they are the way they are today?
I think it's really fascinating how people actually do go right into the depth of where the problem started.
Yeah.
And I think that could be the key as to why IEMT works as well as it does. So even within my case studies that we've talked about today, there was, there's circumstances where the stuff that's put on the intake form is not what you end up working on at all. And actually you get to the core of the issue very, very quickly with IEMT. Yeah. There's no beating around the bush, so to speak. And I think that's probably why also maybe if you have trained in other forms of therapy, you bristle slightly at first with it, but then you realize that actually this is so effective, and this is it's challenging for people without it being stressful. It's not stressful for people. It's just takes them to the core of the issue very, very quickly. Yeah, that makes sense.
Yeah, absolutely. And the reason why we do the basic assessment is a regression. So if somebody feels this way now about something, being in an audience, or how they feel about their partner, or an aversion to I'm trying to look, well, there's a fear here. Little holes, right? These are sort of sight improving glasses. They're just as a novelty.
I know. I had some
Yeah,
years ago.
yeah. Pointless.
It didn't work.
No. But the reason why somebody has a feeling now or a reaction to something is because they've had it before.
Yes.
And so what we find is that when people go back and learn how they feel this way, begin to feel this way, just getting to that point is hugely cathartic in itself.
Yes.
That if people know why they're messed up, basically, oh, that's what that makes sense. And so what we do in IEMT, we allow like this free floating movement of thought, as basically we go to the imprint and then we allow that to change to go to other things. It connects up these wide kind of networks of people's patterns and history. And what I tend to find is that people come, they get a lot of aha moments.
Yes, I was just about to say that, that you'll get people who know those connections, but you'll also get people who have no clue about the connections. But once you ask them that question about going to the first time they felt like that, or the first memory when that was happening, they, as you say, aha moments, and the penny drop moments, where and then the connection, they'll realize what the connection is to the problem they came in the room with.
Yeah, because when people go, something will come to you, so what's wrong? Oh, I'm demotivated at work. Okay, so what's the issue? Basically, you go back to it because when they were 7 years old, the teacher scolded them in front of the class. But they're not going to come and say that. So why are you here? Because 30 years ago I got in trouble at school. They're not going to say that. So IMT say it's an exploration of the actual issue itself.
And so far, I haven't had a single person who's not been able to tell me that what the first imprint was. It's not happened. I'm sure it will at some point, but it hasn't.
And if it does, there's ways that we can work with it, which we cover in the course. So there's kind of ways around that. And if we can't find it, we do something else.
Yes.
It's not a square peg round hole thing. If it doesn't work, it doesn't work. You do something else. That's why I always think it's really important to have training in multiple therapies. I find I love EMDR, but from my understanding of EMDR, it's very linear. You do this. Well, if you get stuck here, what you're going to do, you force it through. With IMT, if you get to here, well, we've got a suite of tools, and we can attack it. We come to it in
yes, I'm so glad that I actually did IEMT now rather than the EMDR. Now that I know the difference between the two, I'm really pleased that I came across IEMT and actually trained in that, because I think it's going to suit me much more, and it's going to help my patients, my clients much more, I believe.
I've had a lot of EMDR people come and do the IMT training, and they just say, not only is it more flexible, it works on a lot more different things, especially which we'll talk about in a minute, which is the identity work, which just isn't covered in EMDR. And also, IEMT, Andy said that his biggest regret, maybe, or one of his regrets, was calling it IEMT because it's much more than eye movements. Eye movements is like a quarter or a third of the whole process. There's a lot more involved in it. And obviously the patterns of chronicity and everything, and the identity. And one of the things that you did as well was one of my favorite things that we do is the episodic time, where it's literally like a timeline kind of exercise, and it really just shifts people's perspective of where they were to where they are now. So we worked on that. So we did the training the first day, which is about the emotions and the memories. And the second day, we start to do about the identity work itself. So was the identity work, was this new to you? Did you know anything about this, and how did you find it?
It kind of linked in with, I suppose, with lots of work within hypnotherapy. Kind of you can see, crossovers between some of that, like inner child's work. I did a lot of inner child work with hypnotherapy, and it's something I still will do. However, what I find with the IEMT identity work is that because you're working on the 4 different ways of perceiving your identity, it kind of smooths them out. By the time you've actually worked on all 4, they link up, and the people that you're working on seem to, I'm trying to find the word, It's like a jigsaw coming together.
Yes, yes.
It's like a jigsaw coming together, and it's smoother and less disjointed.
Yeah.
So
Well, it's IEMT, so it's integration, literally
yeah,
integrating the
that's the
different
right word. Thank you.
parts. Yeah, yeah, yeah,
Integrating.
yeah.
Yeah, it's integrating the different kind of ways that we perceive ourselves into a whole that works and is positive for the person. And that's how I've perceived how I've experienced it really when I've been
Yeah.
working with people.
So I did quite, because I've been to lots of courses where people will talk a good game, but then they don't do any good demonstrations. And I do lots and lots of demonstrations with people. And we did a really good one. I won't mention a name, but I don't know if you remember.
Yep, I
Yeah,
do.
and so she's changed. She's had fantastic results since.
Absolutely.
Really,
Yes,
really well. But
yes, yes.
in fact,
And
no,
people look
she.
different, don't they? It's like
Oh,
we were talking when I was
yeah,
we were talking about the case studies
yeah,
between the session 1 and session 2. People just look so different. You know, like weights have been lifted off their shoulders, but
yeah,
also they're brighter, they're more positive, they're less stressed and anxious, they're calmer, they're
yeah.
dressed differently, they
Yeah.
smile. It's amazing.
And this is without telling them to do that.
Oh no, no,
Yeah,
and
this is
once
just
no,
this is just a
yeah,
natural thing. It's like
yeah,
if you imagine somebody who's suffering emotionally about, we'll get into your cases and stuff, but they're going to feel crap, and when you feel crap, you treat yourself like crap, and everything is coloured by this crap filter.
yeah.
And when you start to take these filters down or clean these filters, again, people start to have a lot of self-worth, and they start to invest in themselves,
Yes.
and they have a lot less stress, and so they look better. Their blood pressures can sometimes be improved. Their skin can, because their blood flow tends to improve. And so I've had people turn up for the second session. I had this one guy, and he was a really nice guy. But when I first met him, he had like a scarecrowish kind of thing going on. Like all his hair was kind of messy. He looked very studenty, like he'd been to a festival and everything. And I'm not saying it's a bad look. It's just he was. And then I was sat in my waiting room when I used to have a clinic, and this very well dressed gentleman kind of came in and sat down, and we were sat there, and I was just checking my phone, and he goes to me, Matt, are we ready to start? And I was like, I'm waiting. What? And I didn't realise it was him. I genuinely didn't realise it was him, because he'd always felt really bad about himself, and then we worked on that, and then he'd gone away. He'd bought new clothes. He'd sort of shaved his beard and had it all done. He'd had his hair done. He looked completely different. Because when I first met him, he was all very jittery, and he didn't even look me in the eye in the first session.
Well, a personal disclosure, since the work I had done, because obviously we practice on each other during the training, I have found that I no longer hold back on treating myself, and I no longer have any issue with going for a massage or taking time for me. My balance in life is better than it was.
Brilliant, and that's a real key thing as well. So, like I say, we prepare this, and you get an awful lot out of the course. You're not just watching me doing demonstrations. You're doing about 10 at least exercises.
At least,
Yeah. And there's extra practice, which we'll talk about, the support and stuff as well.
Yes.
And so the second day we do the identity work, and then we do the PSACs, the physiological state accessing cues, which is like a body language thing. And then basically go through the actual certification process of what you have to go and do. So once you did the weekend, you then go and work with 2 people, and you do 2 sessions each with these people. And then you feed that information back in the format, and then we review it like we've just done today. So basically, the big question is, how did you find taking what you'd learned from this weekend and actually taking it into the real world and working with people who didn't know what IEMT was or what you were doing, basically? So you can't get false positives because they don't know how to act, which I really like, because how do you feel now? Oh, much better. But, with IEMT, you can't really fake that, sorry.
Yep.
So basically, how did you find taking what you'd learned and actually working with your case studies?
I didn't find any issue really at all. In fact, I was keen to get going with people. the writing up was getting time to do the writing up,
Yes.
which is why it's been a few months after the training. But I was keen to get through the training and get going on it. And the people that I worked with were interested in what IEMT was. Yeah, no issues really with that at all. And I had I was just lucky, but I had two very good outcomes from those sessions. They gave me very good feedback and reviews. And as you said, we're going to also talk about the group and the support from the group, because I've done more practices just to keep my hand in since then as well. So I haven't just done the 2 case studies and then left it. I have also been doing some other practices it's like when you learn to drive a car, isn't it? If you stop doing the lessons for a while, you're going to be rusty when you come back to it. And I didn't want to be rusty. I wanted to keep it in hand and keep going with it. So yeah, I haven't found it difficult at all, Matt.
Perfect. And what was the reaction like when you applied these eye movements? Because they had no idea, I suppose, about what it was going to be like. So
I think the first lady was probably a little bit doubtful, but is too polite to say it.
Yeah.
You could see in her body language and her facial expression that she was probably just exactly the same as me on the first few hours of the course. It's like, really, is this gonna shift all of this? And was amazed when I recalibrated and actually asked her to go back to the feeling just how far things had shifted. So for me, the proof is in the pudding.
Yes.
Probably the best way of putting that. I also had a few situations at work where, because I'm working within a mental health situation, and I'd put stuff up on my Facebook about training, that people asked me about it. And I'm probably at this point maybe not the best at explaining what IEMT is to somebody. I'll probably get better at that as time goes by. But so I could see that they were a little confused by my explanation. So I said, "Hey, have you got something you'd like to work on?" And they went, "Yeah." And I just showed them basically just 5-10 minutes of a quick demo, and they were absolutely blown away. Absolutely. One of them was a general nurse who just started working within our team, and she was like, "Whoa, magic." I said, no, it's not magic.
Yeah, it is. And that's the thing. And people say, well, how long does this last? And you've spoken to both of the people you've worked with, and that was several months ago.
Yes.
And they've continued,
Absolutely.
Absolutely.
One lady, the first case study, the one that I was referring to as being a little bit doubtful at first, she would normally be in touch with me regularly for support, and she hasn't been. She's not needed to be. Things have definitely shifted.
Yeah. And this is what I always check in with people, like after a couple of months after I've done sessions with them. And it's amazing. I always say it's like an opportunity to go and change. And because IEMT works on both past issues, and then we look at the future, so we can smooth out the problems, so you can move forward with much less motivation and energy. You can literally just progress in a much more natural way, because you don't have all these beliefs and feelings and just blocking you. And so you can smooth it out and literally just kind of move forward. So after the course, you do your 2 case studies. And then what I think, because, you can go and do your IMT training in, I don't know how many trainers there are. There's at least a dozen, I should imagine. I believe that my Aftercare is probably the best. I think because we have a WhatsApp group. We have a Facebook group. I do a lot of email support as well. I'm on the phone quite a lot, a few times a week with people as well. And I make lots of videos. When somebody has a question, if it's a really good one, I'll say, put that in the actual Facebook group and I'll do a video like that. So basically, how has the Aftercare support been for yourself?
Fantastic. I couldn't ask for more, really. You are on the end of the email if we need any questions to be answered, or if we've got any worries or anything, I've always had an answer from you, Matt. I've never had an issue. Not that I've had big issues either to ask you about, but if I did, I know you're there. On top of which, the Facebook group, I find that really helpful. Haven't always managed to get to the talks and stuff because, you know, life gets in the way sometimes. But you know, they're there. You can access them afterwards as well. You can go into links and access
The lives,
them afterwards. Yes, the lives. And the WhatsApp group, I think that's really helpful because you're talking with people who've done the training with you at the same time. I've kept quite strong connection with a few people that were in that WhatsApp group. And there are things happening, you know, kind of future plans for how we take this forward happening through those connections. So that's fantastic as well. And that gives you a kind of peer support as well as the support from the teacher. So I think you're right. I think your aftercare is fantastic, Matt.
Thank you. It's my experience. I've done, as you should imagine, like yourself, I've been on lots of courses.
Yes.
And I've often found trying to ask a question afterwards to be quite difficult. Trying to get
and sometimes the questions aren't going to be there until you actually try to put it into practice. I mean, that's life, isn't it? You know, you think you know something, and then it's only when you actually put it into practice that the ifs, the buts, the wherefores, the what if this happens starts to crop up, and you actually need to go back for clarification. And that's, I think it's a necessary part of any therapy course. So it's.
I often find it's sadly lacking.
Yes, can be.
So when I started doing this, I thought there's a few key things I want to really get here. I want to make it very modular and easy to learn. I want to make it highly practical, and I want the aftercare to be so anybody can come to me with a question. Because my job is to not only make you a practitioner, but to make you the best practitioner you can be. So I have people emailing me who did the course 8 years ago, going, I had this, and I will respond. You know, I will respond and get back to them. And I will often say to people, put this into the group, into the Facebook group, and I'll literally do a Facebook Live and explain. And what you also get in that group as well, there's Sonia, there's John, there's loads of other trainers.
Very experienced people.
Yeah, who will, because we all kind of, although IEMT is a set procedure in many senses, it's also very flexible, and everyone has a lot of different experience and how they use it and how they sort of integrate it with work as well. So you'll get not just my opinion, but other people's. And basically you take what you want from that and use it, and you feed it back to us. And so IEMT, I find, is a very sort of open source community like that.
Yes.
I know a lot of people are very kind of protective and very like trying to outdo it. We don't allow that. We like it to be very open source. We like people to feed it back and do it. So just a couple of last questions. How do you see yourself now working? Because you currently work in the NHS, don't you?
Yes.
And you do private work, and now obviously you can start to integrate this into your private work. How do you now see this kind of going forward with your private work?
I want to integrate it with my hypnotherapy. So, and in a way, I think that will happen naturally, because there've been points within sessions where I thought, oh, I'd love to be able to do a bit of a IEMT on that. And I've actually spoken about it with a few people. I've not done it because obviously I haven't been qualified, but I have spoken about it with people and said, you know, I've done some training on this, and you know, I'd like to do this in the near future with you and help you with that problem, or shift it in this way. So that's one way that I think that I will definitely be using it. And then I am thinking also of advertising it so standalone as well, so not just with the hypnotherapy, but also to offer IEMT sessions as well. And I think there are some occasions where, and I think, you know, people who've done hypnotherapy for a while will all remember that there are people who are a bit freaked out by the idea of actually being hypnotized. So I think there are times when IEMT will come into to being as such with the therapy for people who are nervous about that, or need to get to know me a bit more before they can allow me to do that.
Yeah, and so you can even work on the feeling of why they're nervous to be
Yes,
hypnotized. I've done that before.
yes,
But
yes,
my background's in hypnotherapy as well, and what I tend to do, as we were talking before, I will use IEMT for the heavy lifting, the main parts, and
yeah,
then generally at the I don't really do it so much now online, and that's what I like about IEMT. It's fully conscious. There's no people close their eyes to access things, but it's no hypnosis. It's no trance work. Um, I will use hypnosis in the last 10, 15 minutes to basically, I create a pattern out of the work that we've done and to basically cement it all in. That's how I
yes,
use
yeah, yeah,
hypnosis and IMT kind of combined.
yes.
And
And I think that I'll probably be mentioning IEMT quite a lot to people, both from a therapist perspective. But one thing I haven't actually mentioned, even within our chat before with you, is that been asked by Amanda, who was on our course, to actually be one of her teachers within the Northern College of
wow,
Hypnotherapy. So when I'm teaching, believe me, I will be mentioning
brilliant,
IEMT a lot.
excellent. She's based up in Harrogate and
Newcastle, I think
Newcastle.
she's based in. Yeah,
I,
so she's actually developing hybrid teaching. So it's kind of half on, so you've got your classroom, but you've got people online as well, which will be perfect for here on the Isle of Man, which is
yeah.
yeah.
Well, there's only about 7 people on the Isle of Man.
No,
You're the only IMT practitioner there. I think you probably might be, to be honest.
I think I probably am the only at the moment IEMT.
Have that on your business cards, the only IMT practitioner on the Isle of Man.
The only and the best.
Can I ask you? Do you, when you're doing your private work now outside the NHS, do you have any particular type of clients that you kind of work with, PTSD or abuse, or is there any kind of core?
It's very eclectic, to be honest with you. But I would say my specialism is probably the child and adolescent mental health, because I've become known on the island for working with children and teenagers. There's lots of people come for school phobia. And, you can imagine with the pandemic, I mean, it's all over the television at the moment about the increase in eating disorder with young people, the increase in anxiety, illnesses with it. So that's probably become my specialism just naturally, However, I do also work with lots of adults for sleeping issues and phobias and all sorts of things, really.
Perfect. You should check out Mavis's work. I don't know if you know Mavis.
Yes, you have mentioned Mavis to me.
Yeah, if you check
and
out Mavis.
I have been in touch with her about the children's the training she's developing for using IEMT with children.
Cool. Yeah, because she's a former, I think she's a retired teacher, if my memory serves me right. And but she's developed lots of ways of working with children. And what's really good about IEMT, you can sort of gamify it and get them to, can you hold the memory? Can you hold them? And then especially with like the episodic time, the PSACs, because I've done a lot of work with a woman called Gemma Bailey who does NLP for kids, and they will get like coloured mats on the floor, and they will literally get the children moving and changing states. And so you do it that way, and also with the episodic time, you can actually get them physically moving to do it as well, which works really, really well. One last question, then I think we'll start to sort of sum up here. I'm sure you've done lots and lots of training courses in your past.
I have.
Where would you rate, not where would you rate, but what's your sort of overall experience of going through my course? Basically, how did you find, because I know that I sort of present in a very different way than what's kind of, I've been to some courses that, let's just say, they're a bit dry. And I've been to some courses where it's very entertaining to watch. Didn't learn anything, so it's very entertaining. But I'm still like, I'm not quite sure where it kind of. So how did you find that the sort? I'm not searching for compliments. Basically, what was your overall? Because I know you.
If people really want to add in a very useful tool within their toolbox for therapy, and they're pragmatic, and they don't want to waste their money or their time. They want to actually do what I've just said. You're the man to come to.
Thank you very much. No, that means an awful lot. I think we are done. I've taken up enough of your time today. It's been I did say would aim for 15, 20, but it would
Yeah,
go
that's fine.
a little bit further. If anybody wants to contact you for sessions, what's the best way to get hold of you?
The best way to get hold of me would be on my email, alimanx@icloud.com, or I'm about to, obviously when I get the certificate comes through, I'll add it onto my Facebook page as well. So at the moment, my Facebook page is Triskel Hypnotherapy, because that's basically what I'm offering, but it will have IEMT on there soon enough as well.
Okay, so I'll link it down there as well.
Yeah.
On there. Do you do Instagram or anything like that, or
No, I'm not really an Instagram
no
person.
TikToks,
No
no
TikToks.
Snapchats?
No
No, I
Snap.
don't. No, I don't do anything like that because I'm not a 10-year-old girl, so I don't.
My exactly. My website isn't great at the moment. I'm having it redone. So
Okay.
that's why I'm not pointing people to the website at the moment.
Cool. Well, thank you so much for your time and good luck. Oh, can I just ask one last little thing that I promise I'll let you go. I know that you obviously work within the NHS at the moment, and IEMT is obviously not available within the NHS. So I don't even know what really what the question is here, but how could you see IEMT and how do you think it would sort of benefit being used within the NHS?
I think the benefits would be absolutely dramatic, and I don't actually think it would be that hard to get it in there. I'm not actually doing therapy within the CAMS role that I have at the moment. However, the psychologist that worked within our team before she went off maternity leave, she offered EMDR, and I can't see that if you can offer EMDR, I cannot see why you wouldn't be able to offer IEMT. And it's about people understanding that it's evidenced. I mean, the NHS is very, very focused at the moment, at this point in time, on clinically evidenced practice. And if we can get to the clinical evidence there to back up that this works, then I don't think that it should be a problem to get it in there. I can imagine that in 10 years' time, maybe even before, if we're really, really positive, that, a lot of problems that are silting up services at the moment could be completely alleviated.
I think that I talked to you a little bit before. I even think that GPs could use some
Absolutely.
AMT
Absolutely.
within a short session.
Absolutely. I mean, if we think about CAMS services at the moment in the UK as a whole, they tend to be thought of as within tiers. So a community CAMS team is a tier 3. And I think you could have IEMT at tier 2, so below that. So you were stopping children having to be referred to a tier 3 CAMS service. Therefore, the wait lists go down, the pressure goes down, and people get better quicker.
And could you imagine
lives are changed?
Could you imagine, and when you go to see your GP, say you have depression, whatever it might be, that you could go to, say the GP ran, I know some GPs do this, they could run like a group.
Yes.
Where you could have 10 people, you could teach them some IMT and they could work on each other.
Doesn't even have to be the GP, practice nurses.
Yeah. You could literally have all the people who've come to the session could literally work on each other. Because that's what I do. And I give, I used to give talks. I would have a huge room of people all working on each other. And I think that this is my role now, just trying to really make, I don't like the term raising awareness. I want to raise the use of IEMT.
But yeah, it's about that. It's about raising the use so that we get the research to prove the clinical evidence. And once you've got that, then your route into NHS is quite clear, I think.
Yeah, cool. Well, I'm going to feed this back to Andy because I think it's going to be a very big year for IEMT. So cool. Thank you very much for your time and enjoy the Isle of Man and being the only IEMT practitioner on the island. See you later. Take care.
So thank you. Bye.